That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Well, hey everybody, this is Real Health with Brandi and Amir. This is Brandi Rashidian. I am Dr. Amir Rashidian.
Welcome back.
And this is where we talk about how to feel better, get stronger, live longer, and feel younger. Very nice. And so, you know what we do on this podcast, by the way, this is episode number 5. So we're still in the single digits, but we're moving right along, and we've got some great articles to talk about and share with you. Basically, we want to take the current events and current news regarding health and bring it to you in a practical way and talk about what it means from a wellness and health standpoint and whether this is information we can use for ourselves, our betterment, and so on.
Absolutely.
And so the first article we have is actually sad and tragic. Track star Tori Bowie died in childbirth. You know, I remember watching her run in the Olympics.
Yeah, she's amazing.
And I always enjoyed her post-race interviews and so on. But she was actually crowned as the fastest woman
in the world.
Yeah,
right?
It's pretty amazing. So the article says the track star Tori Bowie was 8 months pregnant and in labor at the time of her death. And this is according to an autopsy report shared with the New York Times. The autopsy lists respiratory distress and eclampsia as possible complications. So this story is obviously from New York Times.
Now, let's make note right off the bat that it does say a few paragraphs down that this was a preliminary autopsy report. It will take and can take up to 3 months for them to get the official. Ooh. So a lot of what they're seeing is just surface. They're not sure what all was involved yet.
Speculation.
It is speculation, but this is their best thoughts as of right now.
Right. And, eclampsia is the hallmark of it is high blood pressure, and respiratory distress just means she wasn't able to breathe. But
right.
It doesn't tell us what caused that distress.
Yes.
And typically healthy people, especially athletes, don't get eclampsia.
Yeah.
So it does seem kind of odd, and the article doesn't mention that. But Tori, a sprinter who competed at the Rio de Janeiro Olympics and won a silver medal in the 100 meters, a bronze in the 200 meters, and a gold in the 4x1 meter relay, died at age 32.
Gosh, that is so young.
And it was days before she was found. So they actually had to look for her because they didn't know where she was, and then they found her passed out.
I think it was a couple days that she was in her apartment. They did a well check because none of her friends or family had heard from her. And so when they went in to find, they found her, and she had already
They do
passed.
say there were no signs of foul play. And they talk about preeclampsia. So they say she died of eclampsia and respiratory distress, but preeclampsia is a dangerous condition characterized by high blood pressure that develops during pregnancy, and it can turn into eclampsia, which is a rare and severe complication characterized by seizures and the onset of a coma. Now, I do know people who are diagnosed with preeclampsia. Basically, if their blood pressure is higher than normal during pregnancy, they call them preeclampsia. They put them on bed rest. If the blood pressure goes up higher, they actually induce labor or send the patient in for C-section. It didn't even say if she was ever diagnosed with preeclampsia, right?
Well, there's a lot of holes in this, and there's a lot of conjecture. So I think that needs to be suspended. What we do know is she was in fact pregnant, 8 months. Like you said, they don't say whether or not she had a prior diagnosis of preeclampsia. So we just don't know. I think we're going to have to wait and see. But
now, many studies have shown a greater risk of preeclampsia among Black women in the United States. So I guess what you can apply from this is if you're expecting, check your blood pressure on a regular basis.
Absolutely. There's another article that was put out by the Washington Post because of Tori Bowie's death. And it just goes into talking about, more about preeclampsia and, high blood pressure in pregnancy and what that can lead to. So I went through and I kind of parsed out some of those signs and symptoms of preeclampsia. sometimes this goes misdiagnosed or undiagnosed because a lot of the symptoms of preeclampsia are very similar to some of the symptoms and some of the, crappy things we experience,
Just
while
with
we're pregnant.
pregnancy. Yep.
Yeah. And so some of those are high blood pressure, with or without protein in the urine. Those will be checked during your prenatal visit. So obviously that's a huge thing. Go in and get your well baby checks. We need to be checking on those things, making sure everything is okay. Changes in vision, like blurriness, flashing lights, seeing spots, or being really sensitive to light. Headaches that don't go away. Nausea, feeling sick to your stomach, vomiting, or dizziness. This is one, obviously, very clearly, many of us experience it. I was throwing up 10 to 12 times a day with our first, through, month 4. So,
Yep.
I experienced that a lot. Pain in the upper right belly area or in the shoulder, which is interesting. Sudden weight gain. I didn't see in the articles that we were looking at, which is part of the reason I pulled this up, is they said sudden weight gain. Well, for a pregnant woman, what is that, right?
Right.
What is sudden weight gain? They are noting that is somewhere in the realm of 2 to 5 pounds in a week. And then swelling in the legs, hands, or face, and then trouble breathing. So again, if this seems, maybe even if it doesn't seem super severe, those are things you want to get checked out for sure.
Absolutely. And we don't want people to panic because we know how when you think about a condition, it
Correct.
manifests in your body. So if you are expecting and you're midterm or late term in your pregnancy, last thing you want to do is fear and worry because those things make you more sick.
Absolutely. And remember too, this typically is not going to take place prior to 20 weeks of pregnancy. So most of the time, some of those severe nausea and vomiting, that subsides, prior to 20 weeks. So we're talking about 20 weeks or later. These would be severe symptoms at a time where, I always giggled a little bit when they would say, oh, in your second trimester, you're going to feel like Superwoman. Maybe if you experienced that, I just felt less crappy than I did the first trimester. So I don't know about the Superwoman thing, but definitely a lot of my symptoms subsided by then. So
When you're Superwoman all the time, then there's no difference when
he totally gets
that.
points for
Yeah.
that one. So, so those are some of the symptoms. They should subside after pregnancy, but come to find out, I did not know this. In some rare cases, preeclampsia can also happen after you give birth, but it is really rare that happens. So mothers are most at risk of postpartum preeclampsia in the first 24 to 48 hours after delivery, and they must be monitored. And the only additional symptom that we often see in postpartum preeclampsia is excessive bleeding, in addition to some of the other symptoms that we saw. So, I think it happens probably more than what we would like. Now, when I was reading this article, I was a little dumbfounded by some of the numbers that they give. Now, that is kind of my personality. I question those things all the time. And when it doesn't mathematically seem possible, I go, what is this? So I did a little bit deeper digging to see how often these things actually happen. Cedars-Sinai in 2019 stated that 76,000 maternal deaths occur and 500,000 infant deaths occur globally annually.
Wow.
So where they are saying a lot of those are taking place in more rural or underprivileged areas where there's not access to healthcare. So because what they're saying is preeclampsia is we can take care of that. It doesn't have to lead to death. Most generally, when that happens, it's because we didn't know about that for that individual in advance, and they weren't able to be monitored and checked. So something to be aware of and to watch for, especially when you have one of those precious little babies that you're carrying. Question everything. Question everything. Question what people want you to take. Question, how you're feeling. That happened with us even, with our first pregnancy. I wasn't feeling good. It was something very out of the norm towards the latter part of my pregnancy. And then come to find out, I had lost all my amniotic fluid. So we had to deliver early, unexpectedly. So you just never know. Pay attention to your body. And we do know that when you're healthy, right, and you're going through things, you can pick up those signs and symptoms when something feels so out of the norm. Even when you're experiencing or going through something like pregnancy, man, you have to pay attention to your health. We want patients to question their health. We
Right.
want individuals to question their health,
Yep.
but question what you're being told too.
Right.
Question what you're feeling.
Don't
Question the
ignore your
connection.
instincts.
Yeah,
Yeah, your
100%.
instincts typically are right. We see it all the time where a mother will say, "There's something wrong with my baby," and the doctors will ignore her and say, "No, your baby's fine." And unless she insists, they don't check, and then they find out she was right. There was something
Absolutely.
wrong, and thankfully she didn't give up. So yeah, you don't want to ignore your instincts. I do remember that where you had watched that TV show about a
I
pregnant woman
know.
who had lost amniotic fluid, and then you didn't feel right, so you called the midwife, right? And
Yeah.
midwife said, "Come meet me," and she meant go to the hospital. You went to the office, sat there for a while. Long
For a long
story.
time.
The baby's okay. Thankfully, he's now 13 years old, and
And taller than you.
yeah, he passed me in height. He turned 13 2 months ago, and he's now taller than me. The next article is staying in the theme of babies and pregnancy. FDA panel recommends RSV shot to protect infants. This is also in the New York Times. It says a monoclonal antibody shot aimed at preventing a potentially lethal pathogen. Now remember that word lethal because I want to talk about this. A potentially lethal pathogen, respiratory syncytial virus or RSV. We've all heard of RSV in infants and vulnerable toddlers. It would be the second such therapy that the FDA has allowed to be given to very young children to prevent RSV, which is a leading killer of infants and toddlers globally. So
Now we know that these things are hot topics, right?
Oh yeah.
There is there's lines drawn in the sand, or maybe we should say in the cement, because nobody wants to move them.
There's a lot of money involved as well.
Yes.
Right. There's big profits to be made and so on. And I don't want to sound like a conspiracy theorist, even though I am sounding like one. Well, let me give you some numbers. Same article. It says up to 80,000 children younger than 5 are hospitalized annually in the United States with RSV. That's a big number.
80,000.
80,000 every year. Now, watch this. Up to 300 of those die. Very sad. So I wanted to know what percentage is that? Well, it's 0.375%. Now, they called this a lethal virus.
Right.
But 99.625% of these children fully recover.
Correct.
Now, what do you think Ebola was? Now, Ebola is the deadliest virus we know.
Right.
Right? So what is the percentage of people who fully recover from Ebola?
I don't know.
What do you
I have
think?
no idea. Oh, I
Do you
would
think,
say
do you
it
think
would
it's
be
more than it's definitely less than 99.6?
less than 99%. I mean, I would just say knowing how it attacks the body in
Yeah.
general, I would say maybe 10 or 15% recovery.
53% recover.
Wow, that's much higher than I thought.
It is. And when there was an Ebola outbreak in the US, nobody in the US died. So they all recovered, but globally, when there was a big outbreak, and do you remember the first Ebola patient? They had him wrapped, and the ambulance pulled up, and people
Right.
in emergency suits came and pulled him out of the ambulance and took him in, and it was big news.
Very Hollywood.
And we all watched it the same way we watched O.J. Simpson's White Bronco. We were all glued to the TV because it's the first Ebola in the United States.
Right.
Anyways, 53 now. I may have got this wrong. It might be that 53 pass and 47 survive, but it's roughly around 50%
It's pretty
who
close.
fully recover from Ebola, and that's the deadliest virus. So now this one in children under 5, 0.375% die. I'm not saying it's okay that they die. I just don't want to blow this out of proportion because 99.625% of them fully recover.
Well, and that's part of the problem is when we're trying to relay information to the general public. And unfortunately, this is where a lot of people get their health information, right?
Right.
Is by social media and
And
news outlets.
most people don't go and calculate those numbers and
They
look at
don't.
them or
Well,
look it up.
that's why I struggled so much with all the numbers that were being put out by COVID, which is
Exactly.
another day, another topic, another podcast. But you have to calculate this. Look at these numbers. Look at the context in which they are talking about these
Right.
numbers, and then what adjectives we're using to describe it, because that lethal should not be.
I wouldn't call something that 99.6% of people recover from fully lethal. 99.6% of babies who get it recover fully. Now it also says many people experience this common virus as a routine cold, but it can be serious in young infants and older adults. And it does give older adult numbers. Let me give you those as well.
Mm-hmm.
For adults 65 and older, as many as 160,000 hospitalizations are attributed to RSV.
So double.
Double but the deaths are a lot higher. 10,000 die
Okay.
out of the 160,000, which is 1 in 16. So 6%, 6.25% of people over 65 who get RSV
Much higher.
die. It's kind of like COVID. COVID, children weren't hardly affected by it, and
Right.
the older they were, the more severe the problems were. But then you go, maybe these older people also have comorbidities like,
They for sure have comorbidities.
cancer and heart disease and diabetes and everything else. So
And let's also talk about the number of medications that most people are on for those comorbidities, right?
Yeah.
Because it's not just the comorbidity that's changing how the body
right.
responds to these viruses that they're getting. It's also the side effects of the medications and how that changes how the body functions.
I agree. They tested this on 3,200 infants. They were given the antibody shot. After 6 months, they said the efficacy rate was 79%. So I don't know. I mean, you take a healthy baby and you give them the shot, and then you say 79% of them didn't get RSV. I don't know how they
Right.
calculate the efficacy of.
And why are they
of a-
calling this a treatment and not a vaccine? Is it not a vaccine?
Well, it's a monoclonal antibody. So they give someone an antibody prior to exposure. So it sounds like a vaccine. So,
Yeah.
And they do interchangeably say that. A separate agency panel has recommended approval of a maternal RSV vaccine that is under review. Some of the advisors raised concern about data for that vaccine and for another like it that suggested a small increase in preterm births. So they're worried that the RSV vaccine given to expecting moms can cause preterm birth.
Yeah. And here's the thing. Am I wrong in this? Are we not supposed to be testing these things on pregnant women? Isn't there something that says we're not supposed to be doing that? And that's why we don't have the data?
Yeah, there should be anyways.
Yeah. I mean, I want to research that a little bit because that's always been something like I've talked with, my OBs and my midwives about and things because I'm
Right.
super hesitant to do anything while I'm pregnant.
Well, the holy grail of research is the randomized controlled trial studies, double-blind randomized controlled trial study. What that means is you split people into groups. You don't tell them which group they're in, and you give one the treatment, and one you don't get the
placebo.
treatment. You give them placebo, and then you see how they do. So that's the holy grail of research. But do you know that some of the most life-saving procedures don't have any RCTs behind them, no randomized controlled trials behind them? Like there's no randomized controlled trial in open heart surgery. Can you imagine if they took healthy people and cracked their chest open and operated on their heart just to
Right.
How about parachutes? Have they ever done randomized controlled trial studies on parachutes where they give people a fake backpack that say this has a parachute in it, jump and see if you survive?
Right.
And one group had a real parachute, the other group had a fake parachute. We threw them all out of the airplane at 2,000 feet.
Well, and it's actually kind of a shame that we can't do that in any way because there's such a difference in how the body responds when there is underlying disease processes versus taking a healthy adult who doesn't have anything else going on, right? Like the body is different, but yet healthcare professionals all the time go, well, be cautious because you have this risk factor. You could XYZ in 2 years. What we just dealt with that with our son getting his eye exam, second eye exam, and the doctor actually told him, I'm sure she had best intentions, right?
Oh, yeah.
I'm sure she did not mean to do this, but we don't realize what we're putting into our patients' brains.
Right.
Or into their subconscious mind when we say, by the way, when you're an adult, your eyes are going to be a negative 600. Where is your crystal ball? How I
Yeah, how do you
know,
know that?
and if you're tracking and your experiences,
Based
you're
on 2
looking
eye
at
exams, a year apart, she's saying your eyes are going to be terrible by the time you're 18.
for a 9-year-old,
Yeah.
right? And you also have to take into consideration, what does he eat on a regular basis? Does he exercise?
Yeah.
What kind of medication is he on, which can create a reduction in, the effectiveness of his eyes. Like, all of those things come into play, but we give all these blanket statements and tell people that they're going to be terrible. Something awful is going to happen to them. We do
Right.
it and give them a death sentence when they
Or
are
we
diagnosed
pick
with
a
cancer.
virus that 99.6% of people survive, fully recover from, and say this is lethal.
Right.
Um,
And what are they going to see? They're going to see the lethal part, right? Which
Right.
now we're forcing people to operate and make decisions in fear. That is never who should be
Right.
making decisions in times of stress and fear. That is not what you want to do. You
Right.
want to do things level-headed so you can think clearly.
I agree.
But that's not the environment we're
And
providing.
the article ends with the fact that they're still reviewing this and they're going to do more tests, and they don't know what the full risks and benefits are by giving this to expecting moms and babies. So
Yeah.
more studies on that and more news to come. Next article is not as morbid.
Thank goodness.
Yeah, this one is from Medical News Today. Deep brain stimulation during sleep boosts memory, may lower dementia risk.
He loves sleep.
I love sleep.
It's one of his favorite
Very
things.
true. I sleep every day, and sometimes
Twice a day. I was just gonna
Wait,
say.
do you know there's certain species that are designed to sleep twice a day, and a lot of people say humans are one of those.
Interesting.
Because they call this a postprandial dip in brainwave activity, right? Which is, they say when you eat, you get sleepy.
Mm-hmm.
But it's only not when you eat breakfast. You don't get sleepy when you eat breakfast. You get sleepy when you eat lunch. And then a lot of people go, well, it's because you ate a lot of carbs. Then they did a study on people. They gave them 0 carbs for lunch.
Still got sleepy.
And then they said, if you eat a big meal, you get sleepy. So they gave them small meals. They still got sleepy. So they said, okay, don't eat at all. They made them fast. They fasted all day. And right in the early afternoon, there was a dip in the brain waves.
Interesting.
And so if our brain waves dip in the afternoon, some experts say that's a sign that we should all take an afternoon nap. Now, in the old days, they used to call that a beauty rest.
That is very true.
And here's why. People who slept in the afternoon stayed young and vibrant. Their skin stayed clear. And then research later showed that a 10-minute nap around 4 p.m. boosts your growth hormone levels. Growth hormone is what keeps your skin youthful, keeps your bones dense, and keeps your muscles supple and strong.
Well, we are one of the fewer countries that don't do this too, right? There are several, maybe
Yeah.
not fewer countries, but there are a lot of countries
Yeah.
that actually impose, I mean, your home country does that,
That's
right?
right.
They close everything down.
Oh, yeah. The retail shops are closed
Yeah.
from 2 to 4
You
p.m.
cannot shop in the afternoon.
and yeah, everyone goes home for lunch,
Yeah.
and then they go back to work.
They even change into their pajamas.
Oh, yeah. Before you eat, we change into our pajamas. We sit down, eat, so we're ready for bed. So as soon as we're done eating, we lie down. It's a nice nap. It's actually a really good sleep.
Yeah, very relaxing. I'm kind of craving that.
And then, but then after dinner, we all go for a walk.
Yeah.
That's just tradition. You eat dinner, you go for a nice long walk. And I think that's beneficial. So getting back to the article.
Yes.
We digress. So researchers from Tel Aviv University and UCLA Health have uncovered more information on how the brain consolidates memory during sleep. Now, Tel Aviv, you're like, where is that? It's in Israel. And Tel Aviv University actually is very prestigious. They have put out a lot of research. When they put research out, the world listens. They've been published in many
That's awesome.
incredible peer-reviewed, highly prestigious articles. Scientists found that deep brain stimulation applied during the deepest sleep cycle improves the brain's ability to make memories. So basically remember things, not like, memories of, having fun with your children.
Do
But
they differentiate short-term versus long-term memory? Is that what we're talking
they
about?
didn't talk about that, but
Okay.
it says sleep disturbances can increase the risk of developing dementia. And dementia, the hallmark of it is they can't remember things.
Right.
The dementia person with dementia will say, oh, what day is it today? And then 10 minutes later go, what day is
Is it
it?
today?
And then they ask again, so, or they'll say, how are the kids? And 2 minutes later, how are the kids? And what's their names again? And maybe their grandmother. There's no way they should have forgot their names.
Right.
The study was recently published in the journal Nature Neuroscience. So it's a pretty respected journal. But this article was in Medical News Today. So what is deep sleep? So, and I'll tell you how the study was done. They actually took people who have epilepsy. They already had electrodes in their brain implanted into their brain, and they did their stimulation. They did the study on people who already have these. So stage one of sleep is when a person starts to fall asleep and includes light, non-rapid eye movement. REM sleep stands for rapid eye movement. So
Right.
this is non-rapid eye movement. Stage two, and I believe the first stage lasts about 12 to 15 minutes.
Okay.
Right around 15 minutes, you go into stage two, which is deeper non-REM sleep as the body continues to relax. So when and this is not an article, but it's just my studies of sleep, is if you disturb someone during second stage, that's when they wake up kind of groggy. If you ever had a nap that was longer than 20 minutes, 25 minutes, you wake up, you're kind of groggy. That's called sleep inertia. Stage three is non-REM deep sleep stage, and is the longest sleep stage. This is when you're really getting ready to go into that deep sleep. And then stage four is the REM sleep, when a person has their most vivid dreams and is the closest stage to waking up. So
Okay.
now if you wake up in the middle of REM sleep, deep REM sleep, you remember your dream.
Okay.
But if you finish that cycle, you won't remember the dream.
Very interesting.
Now here's what I know. I think his name is Matthew Walker. He wrote a book called Why We Sleep. It's an amazing book. I highly recommend it. But in that, it talks about when we dream, the brain detoxifies beta amyloid plaques in the brain. Plaques build up and people who drink before they go to sleep actually don't hit this stage of REM.
Oh, interesting.
People who take sleep aids, drugs that we're not allowed to name on the podcast,
Correct.
that make you sleepy and help you go to sleep, they stop stage four. And you
Even
don't
over the counter.
even over the counter stuff. Yeah, anything that makes you sleep. Now I'm not talking about melatonin. Some people
Right.
take melatonin, but we do need to at some point discuss melatonin and risk reward of melatonin. So, but that's why alcoholics, when they stop drinking, they start having hallucinations. It's because their brain is dreaming while they're awake.
Interesting.
It's trying to cleanse itself, and they haven't been able to sleep deep enough for years
For that
to
detox
do
to
those
take place.
dreams to detoxify their brain, and so they start dreaming while they're awake.
Wow.
And they get the tremors and everything else. So normally it takes about an hour from falling asleep for a person to enter the deep sleep stage. It is very hard for a person to wake up during this stage. During deep sleep, brain waves are at their slowest, allowing the brain to relax and recover. Researchers also believe deep sleep plays an important role in healthy cognitive function and the formation of memories.
Well, can you also mention, because it probably doesn't talk about it here, and I don't want to digress too much, but there is studies too on what the brain does and how it heals during certain hours of the night, right? So it's not just about how many hours you sleep
Correct.
or getting into those different phases of sleep or realms of sleep, but
Yeah.
right?
Now, the article says deep sleep stage is also the time when the body releases certain hormones that repair tissue, muscle, and bone. They regulate glucose metabolism, which is why people who do shift work, who have interrupted sleep, are more susceptible to diabetes. and keep the immune system working properly. Again, when you pull all-nighters, the next day you're going to get a sinus infection or catch a cold, or that's why people get summer colds. It's because they're not sleeping properly. So it affects the immune system. But you're right. That same book, Why We Sleep, talked about how it used to be we thought if you just get 8 hours of sleep, you're good. But he says you really should sleep from 10 p.m. to 6 a.m. Those are ideal hours to sleep.
Okay.
From 10 until 2 a.m., 10 p.m. to 2 a.m., you go through physical repair. From 2 a.m. to 6 a.m., you go through psychological repair. And I don't know how effective, or I just think it's interesting. The experts say you need at least 7 hours of quality sleep. And we all know the signs of sleep deprivation. I don't have to go through those. We all know it. But long-term sleep deprivation will lead to Alzheimer's, diabetes, cardiovascular disease, obesity, depression, and anxiety. And here's some data that I found was very interesting.
Yeah.
During daylight savings time,
Mm-hmm.
they turn the clocks back an hour, and we lose 1 hour of sleep. Do you know the following Monday, there's 23% more heart attacks in the United States than any other day in the year?
That is fascinating data.
1 hour less sleep, 23% more. I mean, the hospitals know this and they prepare for it. They know Monday morning after they turn the clocks, you are, I guess, move them forward. Spring forward, so you lose an hour of sleep.
Yeah.
2 a.m. becomes 3 a.m. So
And to think, we
get
don't
1 hour
actually
less.
have to do this.
That's a whole different talk. If you're listening, let's please stop the madness. Why do we keep changing the clock every year? Twice a year. We change it back. We change it. Ridiculous. It doesn't matter. Can't we just go 30 minutes forward and leave it?
I think that sounds like a really great idea.
I think Arizona doesn't do it.
Oh, really?
Yeah, state of Arizona doesn't do daylight savings. So anyways, that's cardiovascular risk and diabetes as well. I know blood sugar metabolism gets messed up. If you shift work, if you are night work, you work at night and sleep during the day.
A
be
lot
very,
of our
very
first
careful.
responders are susceptible.
Absolutely. Read that book, Why We Sleep.
Yeah.
There's a lot of information in that. You can read my book as well. There's a summary of it in here called Cracking the Stress Secret, How to Turn Pressure into Power.
And also know you can't catch up on sleep,
That's true.
right? So
Yep.
if you can't sleep more one night,
Yep.
Because you slept less,
Yeah.
a night before.
Actually, in that book, Matthew Walker says it's you can't replenish. You can't recover.
Yeah. So sleep.
It's amazing. Deep brain stimulation may be used as a treatment for certain types of brain diseases, including epilepsy, Parkinson's, essential tremor, dystonia, Tourette's, and obsessive-compulsive disorder. The therapy uses electrodes that are implanted into specific regions of the brain. The electrodes are powered by a pacemaker-like device placed in the upper chest area just underneath the skin. A wire running underneath the skin connects the device to the electrodes. A doctor programs the device to generate the pulses it should deliver to the electrodes. Sounds a little scary.
I struggle with implants in my brain.
Implant. We talked about that at another podcast.
We did.
With the Neuralink. So, implications for the prevention of dementia is, upon analysis, a research team found study participants. I told you they took people who already had epilepsy. They already had electrodes implanted in them, and so one night they showed them these pictures. They paired a celebrity picture with an animal.
Okay.
And they had them sleep, and the next day they had to recall what they saw the night before. And then the second night, they did the same thing with different celebrities, different animals, and then they did the brain stimulation. And the next day, after having their brain stimulated during deep sleep, they were able to remember much better. So,
Interesting.
Upon analysis, the research team found study participants performed better on memory tests after the second night of undisturbed sleep with deep brain stimulation compared to the first night with just undisturbed sleep.
I'd like to know what those improvements are percentage-wise.
I know they don't say that. I wish they would say.
Which makes me wonder if it's not that big.
Yeah, and it also tells me, I probably should have slept all those final exams I took in school.
Right.
Some of them I never slept before.
Yeah. All-nighters,
I
right?
I studied all night, walked into the test, took the test, and then slept. I go, man, maybe if I had slept, my brain would have reorganized and I would have remembered things a lot better.
Yeah.
Who knows? Who knows? Intervention during sleep represents a unique approach that can be further developed in the future to provide hope for people with memory impairments such as dementia. Um, they found that these memories actually create physical changes in the brain, which is pretty cool. And I know we're running out of time. I just want to mention one thing. I saw this a while back, and they were talking about changing the name dementia to type 3 diabetes because there is an enormous link to blood sugar fluctuations and insulin fluctuations leading to brain impairment.
It's
And in
fascinating.
fact, we had a patient after I saw that report, which was, I don't know, 4 or 5 years ago. We have a patient, his name is Terrence, and he was having memory issues. His wife came up and said, he doesn't remember anything. He keeps asking questions. He's forgetting things. I'm really worried about him. He loses his keys. He forgets where he's going. He starts driving. He forgets where he was going. I can't leave him alone. I'm really worried about him. I said, all right, we're gonna cut all carbohydrates and all sugar for 3 months. Let's see what happens. And literally his memory came back, and
Wow.
everything was restored to perfect normal. This is now 3 years later, and he hasn't ever had memory issues again.
That's amazing. That's
So
amazing.
so yeah, be very, very careful. Like we talked about on the last podcast about diabetes, type 2 diabetes. We did have an article on type 1 diabetes that we didn't get to today, but we may mention this on the next podcast if we decide, or if there's other breaking news at that time, we may
Pull
skip
it
it
back out.
altogether. But bottom line, I think what we talked about last time about diabetes applies, and I think that was a good show. What do you think?
I certainly enjoyed these articles, and I'm looking forward to the next ones.
Yep, definitely. Well, tune in again. Please comment, share, subscribe, and help us to get the word out. I think wellness is a powerful thing. I think these topics need to be discussed, understood,
Absolutely.
shared. So help us out, and we look forward to seeing you next time.
Thanks so much.